Hi, I'm Amy Wright, registered dietitian and certified diabetes educator. Today I wanted to talk to you about insulin. I know a lot of people get really nervous when we talk about insulin, but there's definitely a time when insulin is warranted. The American Diabetes Association recommends as a standard of care that insulin is initiated with an A1C above 8. And that means that your average blood sugar is running around 183. And if you can picture this, think about a blood sugar being that high, you really have sticky, sludgy blood. And I know that's kind of graphic, but it's a great way for you to think about what can happen to your kidneys, your feet, and your eyes if your blood is that thick and that coagulated. So we've got to get the blood sugar down. That's really the big priority when your blood sugar is that elevated. So insulin's going to be the most natural thing that you can do to get the blood sugar down immediately. And sometimes people will think of this as the last resort, but if it's that high, that really should be the first resort. So there are different types of insulin, and let me explain them to you real quickly. So there's basal insulin, which lasts up to 24 hours. Usually you inject that once a day. It has a very low risk of having a low blood sugar incident. Then there is a bolus insulin or short-acting insulin, and you would take that. Sometimes it's based on a sliding scale based on what your blood sugar is, but you would take that insulin and make sure that you have food in front of you when you take it, because it peaks within 30 minutes and it's in and out of the bloodstream within 2 to 3 hours. So it can be a very high risk for having a low blood sugar, and so you want to make sure that you're taking that appropriately, especially making sure you have food or snack available in front of you. And then finally, there's MPH insulin. That's an intermediate acting insulin. You don't see it used as much, but for people that are lower income, it is more inexpensive, and it may be the only option. So the way that it works, it's not used as much because it's not as predictive in the way that it works. It peaks within 4 to 8 hours, so that peak is much longer in duration, and then it's in and out of the bloodstream in 8 to 12 hours. So that's a little bit why that medication is not used as often, because it's not as predictable as the basal insulin, which lasts up to 24 hours, and then the short-acting insulin, which lasts up to 3 to 5 hours. So with injections, you want to make sure that you're injecting in the proper areas. You want to make sure you're using a fresh needle every time that you're injecting. And you also want to make sure that you clean the area that you're injecting with an alcohol prep. Sanitation is really critical. And then also make sure that you're not injecting into any scar tissue. I've actually worked with patients that have injected into scar tissue. They kept upping their dose and they didn't know why their insulin wasn't working, and it was because it wasn't being absorbed. But with all insulins, you want to inject into subcutaneous fat, so not into muscle. So you want to make sure that you're injecting behind the arms with the fatty area, in the abdomen, making sure that you're rotating the injection sites. You can also do the hip area or your haunches, but not on muscle. You don't want to inject into thighs or through clothing ever, because once that needle bends, you are really at high risk for causing damage to your skin, also at risk for infection. So this is just a little brief summary about insulin. I hope this is helpful. If you'd like more information, just give us a call at the Health District. Thank you.